This is Anthony Marco, President of the Hamilton District Labor Council. The Council is comprised of close to 50,000 unionized worker affiliate members across the city of Hamilton, Ontario, and we do our best every day to try and ensure that every worker, unionized or not, has a healthy and safe working conditions with wages and benefits that allow them to prosper individually and with families. We believe that the working class deserves to be recognized and fairly compensated for the work they do, and now more than ever, we want everyone to realize that a job worth doing is worth respecting. We are members of the Ontario Federation of Labour, and we're chartered by the Canadian Labour Congress, who represents over 3 million workers across Canada. In 1991, 8 years after the Day of Remembrance was launched by the Canadian Labour Congress, the Parliament of Canada passed the Workers' Mourning Day Act, making April 28th an official day of mourning. Today, the Day of Mourning has since spread to more than 100 countries around the world and is recognized as Workers' Memorial Day and as International Workers' Memorial Day by the International Labour Organization and the International Trade Union Confederation. On April 28th each year, we set out to do two things: mourn for the dead and fight for the living. But those of us who have had friends and families struck down by workplace accidents and illnesses know that it's not a one-day-a-year thing. It's something we have to do every day. One of the greatest challenges we have had over the years is finding the names of workers that have died, because oftentimes news stories come out so quickly that families can't even be notified by the time they've hit the press. And there's rarely follow-up. Of late, we've chosen to remember all of those who've died over the past year through sudden workplace accidents, ongoing occupational illnesses, and some occupational diseases that don't manifest themselves for decades. 1,000 Canadians on average die on the job every year. We must do better as a community to ensure every worker returns home safely to their families at the end of the day. This year, and especially in the past couple of months, the number of workers who have died through lack of proper contagion protocols in the workplace is staggering. And we do remember their sacrifices and the sacrifices of their families to try and keep the rest of us safe. Many of you who are watching this video would normally be attending a day of mourning ceremony in person, but this year the COVID-19 pandemic has turned our lives upside down. While many of us who are not in traditional workplaces every day face new challenges with social isolation and quarantine, those who remain on the front line don't only deal with the mental strain of this pandemic, but the physical threat as well. We cannot speak to those who have succumbed to COVID-19, but we can hear from some of the frontline workers who have had to live through this pandemic, doing full-time hours, sometimes in unsafe conditions, in order to keep the rest of us safe. We mourn for the dead, but we also fight for the living. Our sisters and brothers and comrades who stand on that front line and say, "I will do my job to the best of my ability to keep us safe."
My name is John McSeveny, and I am a cleaner at McMaster University.
Hi, my name is William. I've been an HSR operator for the City of Hamilton for the last 18 years. I'm extremely thankful that my union, the HSR management, and the City of Hamilton, on how fast they acted and implemented changes to make my workspace safer.
Hi, my name is Donna. I work as a PSW in a long-term care home full-time.
Hi, my name is Brock. I'm a grocery store worker. I stock shelves. I usually work maybe 2 to 3 shifts a week during this crisis, this pandemic, because at the same time I'm also a full-time student.
Hi, I'm Rana Dillon. I'm a nurse at the Hamilton Health Sciences Corporation. I work in pediatrics at McMaster.
And I'm just talking about the working in the pandemic. Going to work every day was very stressful. You get anxiety. You're not sure what's going to happen once you go inside the building. But I normally pray and ask for wisdom, and I ask for protection. I go in and prepare myself for the job.
In the last 1 month since March 14th, I've worked 32 out of 38 possible shifts. I think the biggest part that people don't understand is the hospital's under the Emergency Act, which basically lets them move us to daily different jobs, even though we're contracted to a job in an area and a location. The entire night shift got moved to afternoons or day shift. So the uncertainty of not knowing where you're working, what you're doing, doesn't help anyone.
Just talking about how COVID has impacted our line of work, hasn't really impacted as much as the adult population, particularly in the nursing homes and the retirement centers. Basically, we are hopefully going to get some volunteers from the adult floors to go and volunteer their time and services at the nursing homes because they're feeling the pinch right now. Most of the cases have been people in the older population as opposed to the younger population.
My coworkers been putting in really long hours, full-time work, 40 hours a week, even if they're technically part-time staff, and they're really taking a risk by doing this. In one of the most likely areas, you could be right now to catch the virus is at, one of the few places that are still open, which is a grocery store. So it's a really big problem, right? And my coworkers are risking that, some of their family members, their parents, their grandparents, or just, family members who have, medical conditions might not be able to, or might be incredibly susceptible to coronavirus, and it could be a huge problem if they get it. So they're taking a huge risk by doing this. I mean, even my family, with me only going out a few times a week, my parents are always pretty worried about me going out.
It's a funny thing with the cleaners, because the hospital basically has everybody walking around in masks with gloves. But the cleaners, when asked, were told that they would be fired if they wore PPE. Now that was grieved and settled that we could ask for PPE, but they're still not making it issued, even though 90% of the people in the hospital are. They use the clinical excuse, saying that, only in the clinics when you're dealing with the public, but they put up spit guards for the cafeteria and the food areas, and they don't deal with the public. So it's a little concerning that cleaners specifically, when asking for PPE, are embarrassed or told they don't need it.
Eliminating the need for fare collection. Placing a corded barrier, keeping passengers at a safe distance from the operators. Limiting the amount of passengers on board at one time. Spacing passengers out by marking off and blocking seats. Providing safety stations or supply stations at the Mountain Transit Center where drivers can restock up on sanitation wipes, hand sanitizer, and gloves. Making sure drivers practice social distancing at all times.
When I go in the facility, they have protection there for us to wear. The PPE is available for us. However, there were rules as how to use them, and it would be for residents that have symptoms, not for every resident. So we were worried, or I was worried about that, since there's already an outbreak in the facility.
Well, when this pandemic started, I was taking the bus, and then I really couldn't do it anymore, because basically the bus had 30 to 40 people on it, people standing, not maintaining a social distance. So I panicked a little bit and talked to my partner and arranged to be picked up in the evening, but through my own expense, I'm taking a cab in the morning just to feel a little safer.
Personally, I'm very fortunate that, considering my years of service and the level of my seniority, that I am able to sign a bus route in a less populated area. Other drivers are not so fortunate, especially on inner city routes such as Barton and King, where passenger loads are always at a much higher capacity, and where they have to deal with passengers who are not using the service for essential travel.
We go on our day doing what we're told to do. It was very stressful for my family going into work, knowing the situation, that we are not protected with every single resident that we work with. So coming home, it's hard.
I worry about bringing it home. Every day when I come in the door, I run to the washing machine, I wash my clothes, I jump into the shower. I try to keep social distance with my partner. It's a scary world, and we have to worry about those we love. I haven't seen my dad, my family members in basically since Christmas.
Right now we're preparing for an influx, but at the same time with the social distancing, the curve has gone down a bit, but now that the weather's getting better, we're always anticipating that people are going to not go into crowds and cause an issue.
I mean, grocery workers, regular working people, we've always been essential. If we don't go out there and stock the shelves and do everything else we do in the stores, then no one can get the food they need. it's, regular working people are the ones who make this economy work, not the billionaires, not Galen Weston, and that's something that has been made clear by this crisis. Grocery workers and other frontline workers have always been essentials for our economy to work, and my coworkers are really proving that every day now.
Please be safe. Stay home. Help stop the spread of COVID-19.
Practice social distancing. I know it can be a little awkward in the aisles and things like that, but if you have a question for one of us staff members, please just, ask us, just speak up, if you can, because we really can't have people coming close to us right now. And just be nice. I know some of these things, waiting lines outside, something that can just take a while, but please be patient. We're doing our best, and especially for people like cashiers, it's a really stressful job, so please, let us take our time to make sure we all get home safe.
It's very hard. It's a very stressful situation. And then after working for 1 month in the pandemic, I actually contracted the virus. My life changed.
We thank these workers that have shared their stories with us. Their ability to do their jobs safely teach us one thing above all. Proper equipment and training for health and safety on the job matters all the time, not just during a pandemic. Many have called them heroes, but more importantly, those workers who are putting themselves in harm's way should have your respect and gratitude. Some of the jobs that people took for granted before this pandemic have been essential to all of us during it. It is incumbent upon us to rise from this crisis and ensure that going forward, we respect all workers in all jobs. At some point today, during a quiet moment, please take the time to remember those who you knew that died because of their jobs. The respect that we have for their memories should be no less than the respect we have for each and every worker on the front line today. Take a few moments every day, not just April 28th, to mourn for the dead and fight for the living. These are your friends, your family members, your neighbors, your fellow Hamiltonians. In the labor movement, we often say, an injury to one is an injury to all. That sentiment doesn't end at the doorway to your workplace or the plant gates. It must carry on with us throughout our community. An injury to our family, our friend, our neighbor is an injury to all of us. Stand with each other, support each other, in peace, in love, in solidarity. Thank you for watching.